Thank you very much indeed for inviting me to speak, and thank you very much indeed to EASL for doing this joint session with the World Hepatitis Alliance. We're absolutely delighted to be part of this, and I think, it's wonderful that EASL, as they have been actually now for a number of years, are very keen to engage with patients and to put the patient view central to what they're doing. So I'm going to talk a little bit about the Glasgow Declaration, which came out of the World Hepatitis Summit last September. So the summit was a meeting that we proposed to WHO actually back in 2012 because we felt that we needed a forum where governments and patients, as well as civil society, public health researchers and global funders, and of course WHO itself, could come together to really share their experiences. We have to remember that what we're trying to do in viral hepatitis is on such a massive scale that we actually really don't have much experience of doing this. If you look at HIV and think that we now have, I think it's about 16.5 million people on treatment, after, say, around 15 years, we're talking in the next 15 years with viral hepatitis of putting many, many more people through treatment. And if you think of the billions of dollars that have been invested in HIV, we don't have that kind of money in hepatitis at the moment. So it's a very big ask, and we're going to need a forum where governments in particular can share with each other what works. But it's also, the point of the summit is to support the global agenda, and particularly the agenda that WHO are leading. And so the summit in September last year was really to support the development of national plans. Essentially, what came out of the 2014 World Health Assembly resolution, whose number one operative paragraph asks countries to put in place national plans. And then the next one in Brazil next year, at the end of March, will be to support the implementation of the global health sector strategy that Dr. Hernschel is going to talk about shortly. And so during the last year, WHO have put together this draft strategy that goes before the Assembly next month. And one of the key things about it is that it supports the concept of elimination. So that is the goal. And so the Glasgow Declaration came out with this statement as a way to push countries to make sure that they do actually sign off on this strategy. And so that just highlights the background, the huge burden we have, the lack of awareness, the fact that we actually have fantastic drugs and vaccines. And therefore that we believe it's both possible and essential to set elimination as the goal. And I do think that this is, really important. And again, it's been echoed here at this meeting, which is really wonderful, by the societies coming together again to say, yes, elimination should be our goal because we can do it. And that's just a nice picture of a lot of the participants holding up the declaration. But nowadays, we have to think a little bit more broadly, and this strategy fits within the Sustainable Development Goals, which, as you know, are really the world's attempt to address a vast range of issues. And we spent a lot of time, and so did many other people, really trying to advocate to ensure that hepatitis was included in the Sustainable Development Goals, because, as you know, its omission from the Millennium Development Goals has really been something that has held back hepatitis in the last 15 years. And so On the one hand, we were successful in getting it in there. On the other hand, we did not manage to give it the same priority as AIDS, TB, and malaria. And so it does not talk about ending the epidemic. It just talks about combating hepatitis. But one of the things that's important to remember is that it's not the only sustainable development goal that refers to hepatitis. 3.4 talks about reducing by 1/3 premature mortality from non-communicable diseases through, and I've highlighted there, prevention. So last year on World Cancer Day, the director of IARC, which is effectively WHO's cancer arm, said we cannot treat our way out of the cancer problem. We have to concentrate far more on prevention. And clearly, with liver cancer being one of the major contributors to cancer mortality, if we diagnose and treat people with hepatitis B and C, we will do a lot towards the prevention of liver cancer. And also, next week in New York, there is a UN General Assembly special session on the drug policy. And Sustainable Development Goal 3.5 talks about strengthening the treatment of substance abuse. It's unfortunate they decided to use the word abuse rather than use, but that aside, in that area, they talk about the prevention of harms from drug use. And part of that is preventing infection with viral hepatitis. And at the moment, the outcome document, every time it mentions HIV, also mentions viral hepatitis, which is definitely a step forward. And the thing about the SDGs is that they're supposed to be indivisible, they're supposed to be integrated, and they are the overarching framework for all UN organizations. And if you go to UN body meetings now, increasingly everything is put within an SDG framework. And I think all of us, in terms of the advocacy that we're trying to do, have to remember that and should try and couch our asks in terms of the SDGs. And one of the particular things about the SDGs is that there is a commitment there that no one should be left behind. And clearly, although we have many generalized epidemics in terms of hepatitis B and C, we also have a lot of concentrated epidemics amongst marginalized groups, whether that's incarcerated persons or indigenous peoples or people who inject drugs or MSM. And we need to really concentrate and explain to governments that they need to follow this. They have signed up to making sure that no one is left behind, and so it really does apply to viral hepatitis. And I just want to very briefly to talk about what combat might mean as opposed to ending the epidemics of the other diseases. So this is the 2015 baseline out of the Global Health Sector Strategy. And what it really says is, we are nowhere. We've got a huge number of new cases of chronic viral hepatitis each year. We've got very big mortality. We've got not good enough childhood vaccination coverage, very poor birth dose coverage. We do not have blood safety in far too many countries. Injection safety is terrible. Harm reduction, the number of new needles per person who injects drug is very low, and critically, we have diagnosed on a global level less than 5%, and we're treating less than 1%. And if you look at the kind of very top line targets, around 90% reduction in incidence, huge reduction in mortality, as well as this enormous increase in diagnosis, clearly combating it is what we need to concentrate on at the moment, because we've got such a huge step up that we need to do now. And these will be monitored by indicators, but we don't really have many indicators in the SDGs that focus on viral hepatitis, just new Hep B infections. But what we do have is a mortality for cancer indicator, which will be important. And we also have indicators within the Global Health Sector Strategy itself. So just to sum up, The SDGs will provide this very high-level framework, and they can be used to start this process. Elimination is at the end of it, but right now we need to concentrate on getting things going and making sure they're sustainable. And it may be that we get help with resourcing because they're in the SDGs. And remember, the Global Health Sector Strategy, this is only the first one. There'll probably be 3 before 2030. And I think that elimination will gather its own momentum. But what is critical is that we start. We get the show on the road. Thank you very much.